Okay, we're in your ankle here. This is a piece that shouldn't be there. Right there. This is a cannula that comes in from the back. And this is a needle that's coming in from the medial, or I should say the lateral side where you have your injury. This is where you're fractured, is right here. That looks like it's healing pretty well, so we're probably not going to do anything about that other than big loose body back. And the inside of your ankle so far looks pretty good. I'll show you that in a second. Give me that, please. Pull back protrude. Okay, good. So, this is a piece sitting right here, and then we got a piece stuck up in this area, which I have never seen, but I see it on your CT. And I scoped a lot of ankles. But that piece that got driven up between the joint shouldn't be there. And that came out of that bed there, but is not repairable. So that's the main, let's say, where the money is. And that's out of there. Can I have a shaver, please? So, I want to get this video. So this is the space between the fibula and tibia right here. This is the fibula, this is the tibial side, and this is your joint. And looks like it's doing a good job of trying to heal, to be honest. Yeah, I think we will probably. Get some of this scar stuff out of here. So we're looking at the very front of your ankle joint right there. I think it was a good thing not to wait another 3 months, because I think that thing would have really been scarred in. See that shaver one more time. Okay, so now we're going to look down in the front here of your ankle. That's a very anterior aspect. We're going to look down at what we call the medial gutter here and make sure there aren't any loose bodies or anything. We're going to go back in with the scope. Like this, and look in the back corner and make sure there's no surprises. We're going to go all the way across and make sure there's nothing left tucked down here. So why don't you pull that over to the side and give me a pickups. Pick a spit out. This is the posterior tib-fib ligament, and the shaver comes right out through there. And I think we will use the yeah.
Looking at 90, Karen, please.
I'll be correct a second. We're going to roughen this up a little bit because I'm afraid that you're not healing this in really very well. I don't want to have more more loose bodies that have to go in here and dig out of your ankle at some point in the future. Shaver. So this is removal of a loose body and threading and drilling OCD lesion. Okay? There's two codes really. Okay. I want to stimulate a little bit more bleeding here, I think. Okay. 90. This. Make sure we're not leaving kind of loose debris around here. We're losing fluid. Getting fluid or something. That's okay. Try again.
Spoken ankles was this Northern English one. Ah, fucking Northern English. I can just spoken English.
Your thing's hanging out of your...
I know.
Yeah, but it's on the sterile field.
I know.
You gonna need that high band bracelet?
See that?
That's okay.
This is that lateral wall. Let me shave a little bit more. Clear plug cover. Isn't that amazing how the thing got shoved up between there?
That's amazing. That was a significant piece. It probably wouldn't have caused any more condyle damage because it was so far up there, but
It still hurt.
he still would have felt it, yeah.
Shaver?
Maybe.
Kind of flex them, Richard. Flex a little bit. Maybe I'll pick up again. Did that relax him again? shaver again. Okay, that's all we're going to do, my friend. You got to heal the rest.